Welcome. Could you please tell me your name and why you're here?
Hi, I'm Hester Rippen. And why I'm here? Yeah, actually I'm thinking I'm a little bit out of the box here because I'm from a patient association for children in hospital. We stimulate child-centered care in hospitals and also sort of before and after. And I'm actually here to talk about validation. So how necessary is it to actually validate a serious game in healthcare?
Yeah. And how necessary is it?
Yeah, I think it's obviously a little bit necessary, but for me it's more the question, how do you do it? Do you need to do this with clinical trials, with hard data? Is that always necessary? Or is that what the society expects from you? And is it valued higher if we do it that way? And I think it's a serious game, and you want to help somebody to better understand his healthcare process or to maybe even become healthier. So if that person tells you for him or for her it works, isn't that just enough? So that's basically my story. Mm-hmm. And especially because I look at it from the healthcare point of view and the role of patients in healthcare and how that is changing. And how we can use the knowledge of the patient so much better.
Yeah. So do you feel validation is overrated?
I do, yes. Yeah. And sometimes it's amazingly necessary. I mean, if we're talking about medicine and if you need to know you're not going to die, or if it really does have the effect.
If you take antibiotics, that it works. Yeah.
Yeah, you need to know that it works, and you need to know that the side effects are acceptable.
Yeah.
But in a lot of other areas, I think it's overrated. It's overrated to do it by hard data. That hard data is more valuable than soft data.
Yeah. So who is asking for these hard data? Because it seems to be,
I think we sort of, in the Western society, we've grown to evaluate things more if it's got that stamp on it. Mm-hmm. And then I think hard data is where it all came from. I mean, you see the same in medicine. Nowadays, we can more look at alternative therapies, that maybe they also work. And, and it's really a scientific approach. Mm-hmm. And I think we need to move from that scientific approach to who's it really about? It's about the patient. And the patient is at the heart, and he doesn't look at it from a purely scientific point of view. Because he looks at it from a quality of life point of view. And the most important factors in that quality of life point of view are for 90% non-medical and non-scientific issues.
Mm. But probably if you want to get to the patient with an applied game, you have to pass the people who want to have the validation, who want to have the hard facts.
Yeah, and that's what I'm hoping maybe to seed the first seed here today. It's also to take those people with me and let's do it together. Because as a patient, you should not think and do it on your own. And as a scientist and game designer, meet that patient and do it together so it becomes a good mix. And always step back and look at the necessity of validation in this specific process.
Yeah. So you talk about this a lot. You try to convince people that they, maybe shouldn't always go after this. And how do they react? Are they happy that you tell them, or?
I have a great example. We have a quality mark, which we award to hospital, to children wards. Obviously, there's a whole system, but in the heart of that system is the stories of the children and the parents. And like the Dutch Society of Pediatricians, they asked me to come and see their board to talk about my quality mark, of our quality mark. And the first question they asked me is, and how is it validated? Mm-hmm. And then I say, by expert opinion. And it's like, what expert opinion? Except, the experts are the patients, so expert by experience. And they're like, yes, but, at first they're like, oh, that's not scientific, and what can we do with that? Yeah. But if I then explain the whole story and explain that we award this quality mark based on the perspective of the child and the parents, So obviously their opinion and their experience is the most important. And we don't go and judge the hospital on medical procedures or hygienic procedures. For that you need hard data. For this what we do, what is a number 7 or a yes or no? What's that going to tell us? I believe absolutely nothing. And I come from a market research background. So again, I've done so many studies and we were all so happy when it turned out to be a 7 or 8. And I'm like, yes, and now we know what. Because what do we do? Why do we hand out quality marks? To help other hospitals to up to the next level of quality care. And we need to know what it is that makes that kind of care good or not so good.
And sometimes it's really hard to grasp.
So you need to know the story.
Yeah.
But if you only do stories, and if you only do it in a small verbal way, it's difficult to gather bigger data. So we say the future is collecting in a narrative way, collecting by storytelling. And that's what we now developed together with a company who specializes in collecting stories. And we can also look at it from a quantitative perspective, so that we, in an overall dashboard, we can look at the quantitative side of those stories.
If you walk around here, there seem to be like two, I don't know if it's two ways, but there are people here who are really into this.
Yeah.
Hard validating, and there are other people who say no, don't do it. You lose too much. It's overrated. What
Expensive?
Expensive, and why do we really need it? Are these two different worlds, or do they intertwine somewhere?
I think there's still too much two different worlds, but there are pioneers who are intertwining, and I think what we need to stimulate is that there needs to be 100% intertwining, because I think then we get the best results.
And when will we see this happen? Is that a question of years or tens of years? Or
I actually think that nowadays people are willing to change more quickly, because the whole world is going so much quicker and everything. So I'm really hoping sooner rather than later. And I'm already, I was able, in a conversation of 2 hours, convince the board of the Dutch Association of Pediatrics that what we do is okay. And for the purpose is validated enough. So I think we are at that point that we can actually, in a few years' time, reach it.
Does this mean that the serious health market has changed a lot, or is moving really fast, or is at the beginning of a hype, or is it a hype already?
I think it is a hype. I think because I don't know that much about gaming, which is the fun part here. But what I see is the development of e-health in healthcare, and how much advantages you can get from that, and how that's developing, and how everybody from that soft side and from that hard side see the advantages, which obviously one of those big elements is a serious game. So I think now, indeed, it's sort of at the beginning of going to that next level, because everybody understands now we really need to work hard to get e-health to the level that everybody can really
take part and
but also get the advantage from it. It's like, from my point of view, we speak for the children. If you can do e-consults, if you can do better preparation, all digital, all online, all in the safety of their own homes, that's an instant advantage for these children, because they don't have to go to the hospital. Mm-hmm. So I'm thinking, go.
You are here today. Were you here yesterday as well?
No.
So, no, because you have to speak here today as well. Yeah. When will you be happy when you leave? What do you want to get out of it?
I'm happy if I look at, after my speech, I look at the audience and I don't see people going, oh my God, what's that girl talking about? But they actually think, oh, what can I do? What can I do to maybe change my own perspective? That's what I hope to establish. And I challenge them to come back next year and to stand up on that stage and have it done in a completely different way, hand in hand with patients.
Good luck. Thank you very much.
Thank you.